Hi everyone, Anthony Gothier here for your journey to PA school, and in today's video I'm going to show you some unique tips on how to suture. So hopefully you enjoy. Let's get started. The first thing you're going to want to do is you want to put some gloves on, and it's always good to practice with gloves. It makes it feel more like the real thing. So I work in ortho, so we got some ortho gloves here. And you open them up, and I'll show you how to get these on. There's a nice little trick I've learned over the years, and this is called the smash technique. Basically, you lay your gloves out. Some people like to go palm down. I've learned it's easier if you go palm up like that. You have your right and your left, and you're just going to get your gloves on like this. And now you have your gloves on. That easy. So we're going to put this off to the side because we have our gloves on, so now it's time to start practicing suturing. Now that you have your gloves on, we're going to go over the instruments. Now what I have laid out here is what's called the needle driver, and as you can see there's various sizes depending on what you need to do. The longer ones are usually for deeper areas, then you get more superficial, and fine needle drivers like this are more for superficial skin. Interesting thing to note is that they have these teeth here, and these teeth snap and hold it locked in place. This is the most common way. Thumb in the top, index finger stabilizing, and ring finger through the bottom hole. This is the traditional way. Some people like to palm it, which is basically holding it like this. It's all just preference. Remember, it's all in the wrist, and we're gonna go through this together. Now, you have this click here that snaps it down, and you need to push your fingers apart in this direction to open it. It's fun to pretend that you're a gunslinger. Next we have the pickups. There's different type of pickups depending on what you got going on. These are two small ones. Some will have no teeth and others will have little teeth. Depends on what you need to do to pick up the skin. It's usually pretty good to use some little teeth here, and that helps you evert the skin. And then at the end we have our suture scissors. I like to use the ones that have this little loop at the end. Helps you get underneath the suture to cut it. You can also have sharp pointy ones that can be used for suturing also. So those are our instruments. Different needle types and shapes. Usually there's rounded. There's going to be either cutting or reverse cutting. A cutting needle is going to be a regular triangle, and reverse cutting is going to be this inverted triangle. And you have different types of suture depending on what you're going to do. For the sake of practice, I'm going to use this one. So the first thing we're going to do is we're going to practice suturing on something, and the most common things people like to suture on. Bananas are nice, they're inexpensive, easily obtainable, and they could hold the suture pretty well for practicing. I don't like the potassium amount in a banana. I rather have it so I don't get cramps later. The next thing people like to do are pig's feet. Let me go check if I have one. Go into the refrigerator and look for a pig's foot. Don't see anything like that there. Didn't find any pig's feet in the refrigerator. I'll have to tell my wife to get some next time she goes to the grocery store. But sometimes if you're lucky and you have a little kid, you could grab their Peppa Pig doll. And the nice thing about this is you just need the foot. So I'll just get the scalpel, and we're just gonna take the foot. You know what? My daughter would kill me if I did this to her toy. So we'll scratch that idea. The next thing is any kind of synthetic practicing suturing material. I'll make sure that we're gonna practice out of the sun because this one has this big mole that I work ortho, so it looks weird. I'll just make sure we put some sunscreen there. Anyway, now we'll make a little incision so that we could practice suturing. So you got a nice incision there. Now, like I said, you're gonna hold the needle. I'm gonna hold it with my thumb in the top, index finger stabilizing, and ring finger in the other loop. Now the easiest thing to do is it's all in the wrist. So you're gonna pick this up here, you're gonna go in, and you're gonna just use your wrist to curl it up. Now you can come out one side at the beginning, or just come through all the way in one swoop. Now the curvature of the needle is what's gonna help you determine the distances between. You wanna make sure you have a few millimeters of skin in between the incision site. Depending on what type of wound you're doing, if it's really long, I like to start in the middle and break it up and divide it in half each way you go. Or you can start at one end and work your way towards yourself in this fashion. The nice thing is you're going to keep your needle driver in the middle and you're going to loop it over twice, grab the tail, and pull opposite directions so your knots lay flat. Then you're going to keep this in the middle, loop it over once, pull opposite directions so your knots lay flat. You want to keep the knots all on the same side, and you're just going to continue this motion all the way through. Needle driver is always in the middle. You're going to loop it over, grab the tail, and pull the opposite direction. In 5 or 6 throws, you can just cut the suture. So you're going to grab the tails and cut like this, and cut. Now this is a heavy duty suture, so it's not as easy to cut. Now the nice thing about simple interrupted sutures are they're pretty straightforward and easy to do once you get the hang of it. And what's that? Oh, of course. Simple interrupted. Small interruption, you're all done. So for this next stitch, it's called the continuous running or baseball stitch. And I grew up playing baseball my whole life, so I've gotten pretty good with this stitch over the years. It's going to be very similar to the simple interrupted. We'll just make our incision here. And that looks good. Same deal, you're going to grasp the needle towards the back third, holding the needle driver just as before. And we're going to start at the top because we're going to suture towards us. So we'll go all the way through here and we'll come out the other side, push it through. And just like our simple interrupted suture, same deal, we're going to start just the same way. And so driver in the middle, loop it over twice, grab the tail, pull opposite directions. Driver in the middle, loop it over once this time, grab the tail, pull opposite directions. Loop it over once, grab the tail, pull opposite directions, loop over once, grab the tail, pull opposite direction. Now with this, we're actually not going to cut it, we're going to just continuously go with our suturing. A simple interrupted as far as our depth and location, but we're going to just continuously run it down. In a baseball stitch fashion. And as you see, we kind of have this loop, and what I like to do is find a baseball. Preferably the dirtier you find, I've noticed seems to work better. And if you can, you want to try to line it up exactly. I know it's expert technique here. And you just kind of roll it through. Now for those that missed the end there, because I know I went kind of fast, at the end you're going to have this loop, and you're going to just do it just like a simple interrupted. You're going to go over it twice, grab the loop, pull opposite directions, go over once, grab the loop, pull opposite directions, grab the loop, pull opposite directions, and then you're going to just cut it. Now the final stitch I'm going to show you how to do is called a horizontal mattress suture. Now there's different types of mattress sutures. There's horizontal and vertical, but I've never slept on a vertical mattress before, so I'm going to show you a horizontal mattress suture. So same deal, we're going to make our incision here, just a little one. And what we're going to do is a horizontal mattress suture falls parallel along the incision here. So I will show you, it's basically like making a box. So we're going to start at this edge here and come out the other side. And in terms of running parallel, I'm going to show you here in a second. What you're going to do is you're going to come out this other side here, and you could do coming out the other side, pull this through. and you're gonna see how we make this box. Same deal, loop over twice, pull it through, loop over once, pull opposite directions, loop over once, pull the opposite directions, loop over once, pull the opposite direction, and then we're gonna cut it. One thing you can do if you have a little toy bed around, it kind of helps you measure the distance. I like to use the distance of the pillow to the headboard, but everyone's got their own preference. Start just like a simple interrupted. You're going to come out the other side and pull it through. Leave a little bit of a tail. Now, this part is called backhand. The needle is going to be in a backwards direction compared to what I was doing before. Out the same side. And as you can tell, we made our little box. Now, same rules apply. Driver in the middle, loop over twice, grab the tail, pull opposite directions. Driver in the middle, loop over once, grab the opposite, pull opposite directions. Grab the tail, pull opposite directions. For this kind of stitch, you want to invert the skin a little bit. It takes some of the tension off. And once you have it, you can cut it. You learned how to do a simple uninterrupted, a continuous baseball stitch, and a horizontal mattress stitch. Hope you guys enjoyed this video. I'll think of some other tips that I could pass along the way in future videos.